Okay. Dr. Poonam, can you tell us about the effect of infertility and art on men? Do men suffer from infertility less than women, or do they suffer at all?
Yeah, of course, they suffer a lot, but however, it remains an underexplored territory. They are considered the second sex in reproductive research. Just look at the percentage of studies. Only during the last decade, the attention has turned towards studying the effect of ART and infertility on men.
But why is this so? After all, having a child requires both the partners, right?
Yeah, but this undue focus on women is because ART processes largely work on the female body. And there is a normative assumption about significance of childbearing for women. And moreover, men are inclined to resist the intrusive effects of psychosocial research.
So, how do they respond then? What are their thoughts, emotions, social interactions like?
Yeah, the qualitative studies have shown that they feel neglected, marginalized, and ignored by the healthcare team. They see their role as a bystander. Because of this, they feel detached from the whole process, and there is a lot of uncertainty. Moreover, we have to always remember that men find it difficult to speak openly about something so personal and emasculating and taboo as fertility.
Yeah.
So they remain quiet.
So, what is the impact of art then?
So, as the men suffer in silence, they are stressed out by timed intercourse, by giving sample in the clinic, which has connotations of masturbation. And as a result, they develop erectile dysfunction. Many of them are not able to produce sample in the clinical setup.
Definitely, it does have a psychological impact. Can you please put some light on what psychological impact of male factor infertility are?
So here, all these distress factors much exaggerated when the cause of infertility is the male factor. So this is devastating to the men. They go into depression, and because of that, they develop sexual dysfunction that gets more aggravated. They keep it all very secretive to the point that women take the blame and they do not tell their relatives and friends. Because again, always the infertility gets conflated with impotence. They develop new onset erectile dysfunction after unsuccessful TESI. They are unable to produce the sperm needed for a second spermiogram after getting negative results. So all this lowered self-esteem, feelings of loss of control, inadequacy, self-blaming, and guilt spills over onto the wife, and it can be very detrimental for the marital relation, which further escalates the stress which they both experience.
Totally agree, totally agree. And so to conclude, we may say that for men, perhaps the greatest challenge is simply opening up and talking about the experience. It's somewhat of a catch-22 situation. An inability to talk about the emotional impact can stress really men out. Talking about it can also stress them out. The distress of the male affects the female partner as well, leading to greater distress in both the person. So, therefore, there's a need to involve both men and women during the entire art process right from the beginning so that the couple learns to work together as a team to face the challenge of infertility and art. This can actually strengthen their relationship and provide a vital source of much needed psychological support for each other. Thank you.
Exactly. Thank you.